morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Were you one of the 2,000 or so people who took part in the multiphasic blood analysis at the health fair several weeks ago? You should have your results in the mail, but that doesn't mean you necessarily understand everything that is in the results. So that's what we're going to go through today is your multiphasic results, what it is and what it means. And our guest this morning is Mon General Pathologist Ruby De La Mata. Good morning, Dr. La Mata.
Good morning.
And, of course, welcome to my co-host, Kay Murray. Good morning, Kay.
Good morning. Good morning.
All right. Now, I guess that we should probably pull these out. Everybody has them in the mail by now.
Let me pull mine out. Wait
All
just
right.
a minute.
All right. What is the first test that's on there, Kay?
Well, I have to pull it out here. What is the first test?
Okay. I'll say it's WBC white
You're
blood
way
cells.
ahead of me.
First of all, you have to look at your report and see if it is yours.
Oh, yeah. So your name should be on the top?
Your name should be there, your age or your date of birth, and, of course, the gender, because that's important because each of these values are done according to your age and your sex.
Just one other note. Everyone should have received these by now. Is
By
that
now,
right?
they should have. Yes.
And if not, what should they do?
They should call our marketing department, who's
Okay.
in charge of distributing them, and they'll make sure that you get a copy of the reports.
Very well.
And if you have any questions during the show today, that's why we've brought Ruby in to be able to help other people as well who may have the same question as you. So no question is a bad question. The number is 304-296-0041. J.R. Falls, our producer, will answer the phone and get your name, and then we'll put you on the air with Dr. De La Mata. Okay, the information that I have is WBC white blood cells count is on the list. Is that on the list?
Yes. The first set of tests really is a measure of your blood. And WBC is your white cells, RBC your red cells, and of course the rest. And the only thing that this measures is really the condition of your blood. And it is a measure of your anemic or white cells can be elevated when you have an infection. Most of these tests, if they are abnormal, will be marked either high or low or with an asterisk, which means that it may be a critical value.
All right, so we will know or recognize by looking at our results if it's out of the normal level.
Correct.
Okay, and how serious is it if it's just a little over or a little under?
If it's just a little over, it may be just a variation of the testing. There's always a variation in test +3 or -3 on the upper and the lower ends of the reference values.
You have to remember when you said make sure we have the right report because over 2,000 people went through that health fair to get this blood test. So a lot of paperwork involved there. I've never known them to make a mistake yet. However, it's always good to check that. Really, this breakdown that we're given that comes through the mail with our results does explain pretty well what it is. If after we read this we have a question, should we go back to Mon General or should we go to our own physician?
Any abnormal value that is, say, 1.5 or 1 greater than the upper range, you really should take these test results to your doctor.
Because they do not receive it. We get it personally,
Right.
then we must. And what I do, I always take a copy to my doctor
Correct.
so that it'll be on my file. And that might be a good idea.
Yes, because the lab testing is just a measure of your metabolism at that particular time. And we do not know whether you are hypertensive, whether you are overweight, or for that matter, whether you're fasting when you had this test done.
Yeah.
We encourage people to fast at least 12 to 14 hours before the test because there are some tests, such as the glucose, that may be affected by what you eat.
Now, we can go down these one by one and explain if you want to. However, I believe that so many people get all wrapped up in the cholesterol
Correct.
measure more than just about anything else. Do you agree?
Yes.
But there's so many other areas that can also contribute to problems in our health.
Yes, but be sure that you remember that most of these test results are are of value only if it's taken to your own condition, if it's taken in the context of what you have. Okay. Of course,
how accurate are they? How accurate are these?
These are quite accurate.
Very well.
All right. White blood cells are good guys. They're fighting disease. Red blood cells carry oxygen, so that's very important. The hemoglobin hematocrit is another result. What does that mean?
The hemoglobin is the amount of, it's a measure of your status, if you have anemia or not. For example, if this hemoglobin is, say, 4, that's a critical value. We'll probably call you to tell you that you might want to see your doctor immediately or go to the emergency room. Most people in the reproductive period, women, for example, that are still having their menses may have slightly lower, if they're heavy menses, may have a level of like 13 or 12, maybe even lower.
What about the platelet count?
The platelets is important. This is the one that makes us clot. So if you cut yourself and it clots the platelets. If this value is very low, then it might be a very important issue to handle with your. If it is really, really low, it usually would also be a reflection of whether you're making it or not. There are ways of these values changing. Either you're making it or not making it, or you're losing it.
We're going to talk about the chemistry panel next. So if you have a question, there's a lot of items under the chemistry panel. And if there's any particular item in there that you have a question about, give us a call at 304-296-0041. I don't know if I'm going to go through one by one on each one of these, but what are the more important results under the chemistry panel that we should be aware of?
I think today the most important issue in our health in general is really diabetes. And the first test, glucose level, is a measure of at least a screening for that particular condition. And the higher range here is 100. At that level, if your value is 100 or more, it tells us that there might be some issues that you need to address in terms of your ability to metabolize your sugar. And if you are hypertensive or overweight, and this value is, say, 105, 110, that is bordering the glucose intolerance in terms of your being able to handle your sugar. So,
that's why it's important to fast 12 hours before this, especially for that, because it's a snapshot of the previous 12 hours and how your body metabolizes food.
Yes.
So that's very important. So if that has a little warning next to it to contact your doctor, you should do that, especially if you did follow your fasting for the 12 hours previous.
Many of our clients sometimes come to this screening because they already know they're diabetics. And so they may be medicated either with pills to lower the blood sugar or insulin. And if these levels are really very low and you're on insulin, it might be that they are hypoglycemic and they may be a little shaky or sweaty, and they really should address that.
When we talked about that 12-hour snapshot, though, there's also an A1C test. It's more like a 3-month snapshot.
Right.
Would they probably be getting one of those?
Those are tests that are ordered generally by their physicians to measure their ability to control their glucose metabolism. And it's a measure of the last 3 months of glucose control.
So you may be pre-diabetic if it's above 100, but they'll do further testing to make sure and get you the appropriate treatment for it. Okay, under the chemistry panel, the diabetes, glucose level is very important. What are some of the other more important ones?
The next set of tests, the BUN, creatinine, and EGFR, this is a measure of your kidney function. If your creatinine level is high, then it may be that your ability to make urine is impaired. And you can find this in diabetics, again, and in hypertensive people. So it is a good measure of how your kidney is functioning.
Hopefully, you'll have a question this morning for Ruby, 304-296-0041, and you have your results in front of you. And as you look down, if you have not talked to your physician, you can certainly ask those questions this morning. We'll take a break and be right back.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Ladies and gentlemen, please welcome the lipids. We are getting into the lipid segment coming up next on Health Talk, brought to you by Mon General Hospital. Dr. Ruby De La Mata is our guest, and we're going over your multiphasic blood results from the health fair, which was just a couple of weeks ago.
That's right. And as I had mentioned to Ruby, it seems that so many of us, as soon as we get that report, we go straight to the cholesterol and the triglycerides. Those are our worries, but we should, of course, check out all of the numbers that you're receiving from Mon General Hospital. Let's start with cholesterol, if we could, and talk about why it's important we keep those levels normal.
First of all, we have to know why cholesterol is there and what it is. Cholesterol really is a fatty substance, and we make it. So we really don't have to eat it to have it. And it's important to have cholesterol because it forms cell membranes and it makes our cells stick together. It is a substance that is responsible for hormone production, vitamin D. We need it to metabolize the food that we take. But as it is a fatty substance and really cannot go through our bloodstream to go to where they are needed because oil and water do not mix, and we are water-based people. So what happens is that the cholesterol is then picked up and surrounded by a protein and forms a complex. That's why LDL is low-density lipoprotein and high-density lipoprotein, which is the complex formed by the cholesterol and the protein that surrounds it so that it can travel through the bloodstream and go to where it's needed. So you have a total cholesterol, which is the sum of your HDL and LDL and triglyceride. The important numbers here is really the measure of your low-density lipoprotein, which is the LDL, and it's called commonly as the bad cholesterol. Mm-hmm. What happens is that this lipoprotein complex picks up the cholesterol, takes it to the liver, and deposits everything else where it's needed, in your gut, so that you can digest to make hormones and to make vitamin D. But whatever is not used, it then releases, and it just stays there in your bloodstream. And these are the cholesterol that eventually, in small vessels like your coronary arteries or the arteries to your eyes or the arteries in your kidneys, which are small, they can then deposit along the walls of these arteries and eventually plug it. The HDL, which is the high-density lipoprotein, is called the good cholesterol. It's because it is the protein complex that picks up the extra cholesterol that is released by the LDLs so that it could return it to the liver where it's stored or just dispose of it altogether.
Now, the magic number for the LDL is 200 and below. Is that right?
200 is really high.
200 is high.
When these tests must be taken in the context of the individual. If the individual is diabetes makes you really more prone to heart disease. So you would like to see your LDLs lower. And most diabetics also have cardiac disease, and so you'd like to see their LDLs below 100.
Really?
Below 100.
If we take these two numbers and we do a percentage of them, say we're really, really great with the HDL, can we take that number with the LDL and come up with a number that would be good for us?
It's called the LDL-HDL ratio, and it's just a measure of your risk to develop heart disease, and that ratio should be, depending if you're a man or a woman, should be at least below 3.
Okay. Oh, really, we can control our cholesterol. It's all about diet. Is that right? Diet and exercise?
Yes. The first treatment, really, for anybody who has, say, glucose elevation, that's not too high, and a high cholesterol, and a little high HDL, is really dietary and exercise regimen without pills. Mm-hmm. And that's the best that you can do without pills. But essentially, if you are overweight, losing just 10% of your weight will make a big difference in the level of your cholesterol. Mm-hmm. Also, if you're a smoker, please stop, because smoking does irritate the walls of your arteries and makes you have more tendency for this LDL running around loose to stick to it and build up those plaques within your arteries. And
I know we need to take a break. Before we go, though, does age play into this at all besides weight and activity, physical activity?
Well, yes. As we grow older, our arteries in general do suffer the wear and tear of life, and in general, and if you are prone to, there are very few people that are genetically unable to metabolize their fat, and those are the ones that we really need to put on medication. But most of us really eat the extra cholesterol that we really do not need.
Mm-hmm. If you have any questions about your multiphasic results, our last chance is coming up in the next segment. Call 304-296-0041. We'll be back to Health Talk on WAJR right after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Yes, yesterday I nibbled on nothing but raw carrots and cucumbers, celery.
So your triglycerides should be way down.
Yeah,
now, right?
I mean, I'm always eating the right things and exercising correctly, so
your nose is growing so long.
Yeah,
I cannot believe it.
You can tell by looking at me that I'm a liar. But again, triglycerides have to do with the bad food we're eating, processed food.
Processed food, saturated fats.
Okay. Let's move on then.
Fats.
No wings, Jim. Yeah. No wings in
Another
this
fun
program.
one for the men is the PSA. I guess women, do they get that?
No, they don't have a prostate.
They don't have a prostate. Yeah. No
Thank you for letting him know that.
No need
Ruby.
for a prostate-specific antigen for women. It is for men only, and we get those results from our multiphasic, right? And so what are those telling us?
The prostatic-specific antigen is a protein that's released by the prostate cells. And when it was developed, it was intended, really, to measure and follow up prostatic cancer. But we've then decided that maybe we could use it for screening to see if people, under certain circumstances, would have it. But it is a test that does not stand alone. Prostatic-specific antigen levels are only of value if it is interpreted according to the condition of your prostate, which is only determined by a clinical examination with digital examination by a urologist or your primary care. It varies according to age. The older you are, it may be higher. That's why it's really not as specific, and as a standalone test is not diagnostic of prostatic cancer.
We're almost out of time. How important is it for us to know what our numbers are and to have these blood tests at least once a year?
Today, when we as patients, our health system has evolved such that we as individuals must take responsibility for our health. And in multiphasic testing that's offered by Mon General on a yearly basis may be a tool to see how you're doing or the status of your health. For those who know that they have a certain chronic condition, they come and monitor also their status to see how they're doing.
Okay. Again, you have your numbers. Call your doctor. Let them know what they are. Get them a copy would be very important. Thank you so much for being with us.
Thank you so much for having me.
It's nice having you.
You've been listening to Health Talk, brought to you by Mon General Hospital, coming your way every Thursday morning at 8:35. News is next in Morgantown AM on WAJR.